Hello and welcome back to the second part of our three-part segment with Marisa Perdomo, Doctor of Physical Therapy. Marisa Perdomo is a 3-time cancer survivor. She is currently on the faculty of USC, and she treats patients at their outpatient program. She has studied and been throughout the nation talking and discussing cancer and rehabilitation. And in this segment, she's going to tell us a little bit about what she didn't learn or know while she was going through treatment and some of the things that we can do about it. Thank you again for coming back, Marisa.
Thank you, Kimberly.
Why don't you start by telling me some of those things that were hidden from you, that the doctors or the therapists didn't tell you while you were going through your treatment, that you found out along the way for yourself?
Well, I think, there were many things. And being 17, being 20, and then being 35 at different ages of cancer, the issues are all very different. And the one thing that stands out was after the treatment was over, the difficulty in physically getting my body back in shape.
Right.
After the radiation, the chemotherapy, the surgery, it got harder and harder as I got older, number one. And I think back in the late 70s and early 80s, physicians weren't really referring to physical therapy.
Right.
And now they do. So what does make it easier is if you can have guidance about how much cardiovascular endurance exercise to do, when and how to do your strengthening program, what to do during radiation so that the tissue that's being radiated doesn't get tight and you don't lose range of motion, like in my case it would be the shoulder.
Right. And you had a complication called lymphedema. Could you tell us what that is?
Lymphedema is a chronic swelling that occurs as a result of either radiation or surgical removal of lymph nodes or a combination of both. It's basically simply a plumbing problem where fluid collects
that makes a lot of sense.
in the extremity and the exit pathway is compromised. And so you get this chronic swelling.
Do you think that cancer is a much more open topic now than it was when you were going through your treatments?
Oh, absolutely. There's many support groups. If you just Google cancer support groups, you'll get 10 pages worth list of organizations. And you can get general, like the American Cancer Society or the Lance Armstrong Foundation, or you can get very specific, like the Komen Foundation for Breast Cancer, or Dr. Susan Love, who's from the Los Angeles area. She has her own website for breast cancer. There's the Leukemia and Lymphoma Society. There's National Cancer Institute. There's many, Why Me through the YMCA. There's many different organizations.
You are a physical therapist, and I'm wondering if there's a balance. Is there a right way or a wrong way to be? Well, actually, let me ask you this way. Is there a balance between going back to work? Like, for example, should you work or not work while you're going back to your treatment?
That decision is very individual per individual with cancer. Some people have to go back to work because they're the financial breadwinner, or they're the ones who are carrying the health insurance.
Right.
Others, it helps give them their sanity. You know, they say, if I sit at home, I'm going to go crazy. So work is a good distraction. I think the best scenario is for the individual to discuss it with their family or spouse and come up with a solution that works with them so that they have time to heal. But also, if they want to work and it's therapeutic for them, then, go to work. Right. But some people are just too ill. I mean, some people are just too ill. The chemotherapy drugs affect every person differently, and sometimes you're just too ill. So if having a flexible job would be ideal.
Nice. What role does exercise and nutrition play in prevention of cancer?
That's such a tough question. In general, we know that if you maintain an ideal body weight, if you eat high amounts of fruits and vegetables and lower your fat, that those kind of environmental factors, they do help to lower your risk of developing cancer. But I don't also want to say there are many individuals who will say, I did everything right.
What about those ones that have done everything right, and then they did the exercise, they ate properly, and they still have cancer? What about?
We have to understand that the development of cancer is on a genetic level, it's on a cellular level, and then you have external or environmental factors that can, in combination with the genetics, can work together to maybe increase the risk or hopefully decrease the risk. But it's never just one factor. Right. It's a combination of those.
And what have you noticed? Well, actually, would you have any advice for someone who may be going through treatment and maybe sort of experience that angry part of, I did everything right and now?
Right. Well, I'll just tell you what I tell my patients. When individuals who are recovering or experiencing cancer and they come to the clinic and I'm going to treat them for whatever musculoskeletal dysfunction they have, I always say this is a safe environment. What you say in these, within this room, it's confidential, it's private. You can be angry, you can yell, you can cry, you can not talk, you can talk. Whatever emotion that you are feeling, this is a safe place to express it, and that there's absolutely no judgment. I mean, and I think that's good advice for family members who have someone going through cancer.
Thank you for your compassion and your insight, Dr. Marisa. For more information on what we've talked about in this segment or any of our other segments, click on my Kimmy's link at everywaywoman.com. I'm Kimberly, and I'm wishing you well in every way.